'cause I don't wanna fall in love. If I ever did that, I think I'd have a heart attack.
It's also here and there.
Never put my love out on the line.
Okay, so the aorta is right here and right here. There's two parts. It comes out of the left atrium. This is when the blood gets pumped out of the body, out of the heart and into the body. So this
The aorta.
Good.
What's coming back? What's coming back? What brings blood back to the heart? Begins with a
Superior vena
V.
cava.
So look, superior and inferior vena cava. This one and this one. What's this first?
Left atria.
Okay, what's this?
The pulmonary
Artery or vein?
artery.
Artery, because it's
Leaves the right ventricle where it then goes through the pulmonary artery into the lungs where it gains oxygen coming back into the heart through the pulmonary vein entering into the left atria. Once the blood has entered the left ventricle, it is able to begin a heartbeat again, so it will go through the aorta and repeat the process again.
Now the most common type is dilated cardiomyopathy, which can cause all four chambers of the heart to dilate, or get bigger. Specifically, new sarcomeres or muscle units in the walls are added in series, and the chambers grow larger, which leaves the walls relatively thin compared to the large chamber size, with less muscle to use for contraction. In other words, they have really weak contractions, which means less blood gets pumped out with each contraction, meaning there's a lower stroke volume. And if the heart's failing to pump out as much blood to both the body from the left ventricle and the lungs from the right ventricle, patients develop biventricular congestive heart failure. And since contraction happens during systole, we say that this is a type of systolic heart failure. Also, when the chambers get larger, they tend to stretch. Sometimes an X-ray can be helpful for diagnosing dilated cardiomyopathy. As far as causes go, most of the time primary dilated cardiomyopathy is idiopathic, meaning there isn't a clearly identifiable cause. Some cases, though, can be traced back to specific genetic mutations, or genetic conditions like Duchenne muscular dystrophy and hemochromatosis. Also, in some cases, it could be caused by an infection, like Coxsackie virus B, which causes myocarditis, inflammation of the heart muscle, or Chagas disease, a protozoal infection. Also, alcohol abuse is strongly linked to dilated cardiomyopathy, since alcohol and its metabolites have a direct toxic effect on the myocardium. Similarly, certain drugs can also be a cause, including chemotherapy drugs like doxorubicin and daunorubicin, but also drugs like cocaine. Also, wet beriberi, which is having too little vitamin B1, aka thiamine, can lead to dilated cardiomyopathy. Peripartum cardiomyopathy is an important cause as well, where dilated cardiomyopathy can develop in the third trimester of pregnancy or in the weeks following delivery, probably because of issues like pregnancy-associated hypertension, although about half of patients recover following pregnancy. As you can see, there are a lot of things that can lead to dilated cardiomyopathy, and regardless of the cause, the outcome is less effective systolic function. Treatment for severe dilated cardiomyopathy can include a left ventricular assist device, or an LVAD, which is a mechanical pump that literally assists the heart in distributing blood. And in extreme cases, someone might have a heart transplant.